Good morning, Chairman, Co-Chairman, our staff, and all of the audience. My name is Dr. Nantwat Uttamo, and today I'm very proud to present my research project. And the prognostic factor and the survival rate of the osteosarcoma in the Chiang Mai University Hospital. Before presentation, may I introduce my advisor, Dr. Damnersan Phruksakon and Dr. Jongkoni Setakon. My advisor and research team are a very important person to make this project success. Thank you very much. As we know, the osteosarcoma is the most common primary bone tumor. And unfortunately, it is usually occur in the children, especially in the age of the second decade. And the ratio between male and female is about 3:2. The most common site of the osteosarcoma is usually occur in distal femur and proximal tibia. In Thai, every 1 million people, there were 7 children who will be suffer from this disease. And in Chiang Mai University Hospital, 36% of the limb amputation came from the osteosarcoma patient. According to the 4 noble truths of the Buddha tradition, and the second, that is a cause to our suffering. This leading to our objective. The prognostic factor is the very important data that can help to cure and improve the survival rate. This study reviewed the 134 osteosarcoma patients during the 1995 to 2012. And we classify the probably prognostic factor in 3 groups. The first group is the factor that depend on the disease, such as the sign symptoms, the tumor site, the volume, the histologic subtype, and the metastasis at the first time when the patient comes to see the doctor. And the second is the medical factors, including the time of the delay in diagnosis and treatment, the guideline of treatment to prove that patient can get the neoadjuvant or not, the type of the surgery, and the regimen of the chemotherapy. And the third is very, very important. This is the patient factor, especially the compliance. And to prove which factor is significant to predict the survival rate, we use the log-line test to prove it. And we use the Kaplan-Meier to calculate the survival rate. The results of the univariate analysis show good compliance, good neoadjuvant, and good regimen of chemotherapy bring a good prognosis. Why? If the patient has the primary metastasis, a local treatment such as the amputation procedure and the large tumor volume, it can predict the poor prognosis. All of these factors are the same as in the Euro and American trial. The primary metastasis and the metastasis both of lung and bone are significantly in multivariate analysis. And again, this factor is the same as in the Europe and American trial too. The 5-year survival rate in our hospital is about 40%. But if we compare this survival to the America and Europe trial, it's like this picture. The result of the America and Europe is like the top of the mountain, I would say 70% higher than in our hospital. Why? It's like an iceberg that has a big part under the water, hidden the factor that affect to our result. We have the 46% of the primary metastasis. Why? In the Europe and American study, they just only has the 26%. And the high number of the large tumor volume in our patient is more than the Western study. Moreover, 1/4 of our patient has a poor compliance. All of this may affect to the survival rate in our patient. Which factor that can we manage it, and how can we do? Disease factor, age, gender, volume, bone size, the primary metastasis. No, these are uncontrolled. All medical factor, the new chemotherapy, the new effective chemotherapy, it is very interesting. But wait, who want know when can we fight and how much does it cost? Don't forget that we stay in a developing country. Where can we get the budget? So, the patient factors may be a good choice to improve their life by give the education, change the patient health attitude, and adapt the modern knowledge to their superstition. This will bring a good compliance and better of the survival rate. As shown in this study, the compliance is the most and have a major effective in the osteosarcoma prognostic factor. Don't forget that as children, they are a future of us, a future of nation, and most of all, they will be a future of the world. Thank you.